Now, one of my favorite organs, kidneys. And once again, you'll probably not think of the kidneys the same anymore either. All right. But have you ever known anybody that may have had renal failure or kidney problems? Okay. Anyone who may have had to go through like dialysis?
My grandfather.
Is he still alive? No? Okay. So have you ever had to watch someone pass from kidney failure? It's a horrible death for that person. All right? And the reason for that is because of what the kidneys do. In our understanding, okay, we're told the kidneys do what?
Filter.
They filter. Filter what?
Blood.
How?
Like the vessels, right? Vessels in the kidney, like the waste and everything goes to the nutrients. Or, I don't know.
But that's okay, because that's what I wanted you to tell me, okay? Because we kind of have this idea based on what we've kind of learned up to this point until you actually get to my class and have to think about it a little more, that's what happens. The blood flows to the kidney and it's taken care of. Yes and no, all right? But one of the things that I've tried to point out, especially when we were talking about the vessels, is how if we look at the structure of the vessels of the body, you guys remember how I showed that close relationship of the kidneys to the heart? Okay? There's a huge reason for that. Okay? When you look at these kidneys that I've placed out here for you, I want you to note a couple of things just on our exterior anatomy, okay? My vessels. Y'all been studying these. What are these vessels? My renal artery and my renal vein. Do you notice anything about the size?
The vein is bigger.
Vein is bigger, way bigger than the artery. Wait a minute. Does that seem right? If I am so dependent on this organ's ability to filter my blood, wouldn't you think that maybe artery would be a little bigger to kind of line up with this vein? There's a reason for that. And believe it or not, there's a huge amount of blood making it to the kidneys every time the heart beats. And oh, have you ever known somebody who had a kidney transplant? No? Oh, really? Is it somebody that's donating a kidney, or is it one that's been genetically modified, or someone to match? Okay, okay. People often ask, can I live with one kidney? Yeah. Do you need to make life adjustments? Yeah. Okay, but you can donate. Blood flow is great, but having this structure right here that they do is even better. All right? Because even though it's going to have a high blood flow to this organ, what we're doing is we are going to be pushing that blood into the microscopic components of it that will do the filtration. And having that small blood flow in creates, and the big blood flow out, creates a pressure gradient. And I need that pressure gradient at the level of where it becomes microscopic, which means the nephron. I need that pressure gradient to push out the toxins. So, when we look at the urinary system, the primary role is excretion. Form urine. And any toxins that should not be present, hopefully get them out of the body. Excretion. Return to the body anything that's beneficial. That's the goal. So, let's filter that blood, get rid or excrete those toxic metabolic wastes. Meaning, what? Metabolism, what was the definition of it?
Chemical reaction.
The sum of all our chemical reactions. Every chemical reaction that's occurring in the body creates a waste. I need to get rid of that. So that's one of my goals. Regulate blood volume, the amount, pressure, high or low, osmolarity. What is that?
Stuff being able to pass through. Like particles.
That's diffusion. So diffusion, those particles, what's osmolarity? The water. So, blood volume, pressure, water. Then, regulate electrolyte, which are what? What's an electrolyte? Ions. Pluses or minuses. And acid-base balance, pH. And we affect pH by affecting what? Pluses and minuses. Now, the next one, secrete erythropoietin. Do you remember that one? What system? EPO. It's a hormone. Erythropoietin. And that affects red blood cell production. What? Oxygens are important because of CO2s. If something happens and I need more oxygen, I need more red blood cells. More red blood cells can make their hemoglobin. Hemoglobin can pick up the heme group, which can attach to iron, which can attach the oxygen, and get it to the tissues that need it. For example, in a time of blood loss, at a time of trauma, if there has been a huge amount of blood loss, what do they tend to do for that patient to help treat them? If they have lost blood, what will they do to help treat them? Give them blood. The reason for that, they're giving them red blood cells because they need to carry the oxygen while the body carries out this process. This takes about 3 days, 3 to 5 days. So if a person has had a huge amount of blood loss, they can be given blood to help work while the kidneys are secreting that erythropoietin to go to the bone marrow to stimulate red blood cell production, so that their own red blood cells can now pick up oxygen and carry them. kind of cool. Regulate calcium, homeostasis, calcium. Where do we use calcium? Everywhere. People tend to associate it with bones, but does it play a very important role in muscle contraction, nerve conduction? Yes. So help regulate calcium homeostasis and then bone metabolism, because hopefully in part 1, your professor taught you that bone constantly breaks down and builds up. And did they say why it does that? Why does bone constantly break down and build up? If I need calcium, bone gets broken down to release the calcium. If I have an abundance, it builds bone to store it for when I need it. Now that can go kind of wrong in certain ways, but we're not getting into that. Hopefully your first year professor taught you that. And then participate in the synthesis of calcitriol. Anybody remember that? What is that? I got a feeling you're probably going to know.
It's released from it's a hormone.
It is a hormone, but it helps with our vitamin D. Okay, so vitamin D is important, all right? Kidneys are a major player in helping with vitamin D levels in the body. Clear hormones and drugs from the blood, okay, stuff that we would consider toxic. Detoxify free radicals, something that we're learning a lot about because they're thought to be like associated with certain cancers and so forth. And then in times of extreme starvation, famines, countries that may have famines and so forth, remember how I said the body wants to get energy in one of 3 ways. Glucose first, fats second, proteins last. Because proteins, we have to do amino acids. We don't store amino acids in our body. We have to break down tissue for that. And the first tissue that gets broken down for these amino acid components that we can make glucose from is from skeletal muscle. So that's just something that, you know, but we don't want the body to do. Take a break, be back at 10:30.